weird, but we were there for like 2 weeks.
Yeah. Yes.
And they had to perform surgery to like drain it.
To drain it out? Yes.
It's pretty bad.
This is kind of off topic in a way, but when people get their tonsils taken out, why, if you have your appendix taken out, do they not want to take out tonsils?
Because the tonsils are a lymph organ, and so is the appendix. Despite what your anatomy book says, it is not a vestigial organ, it is a lymph organ. We know it has lymph tissue in it. If you take one out, you probably don't want to take the other one out because it's just, they both do something. That's why it keeps getting infected. It's because it is a lymph organ, just like her son had a lymph node probably infected because of strep. So they are actually doing something. Okay? Now the thing about streptococcus, as in strep throat, if you do not treat it, and a lot of people don't because they're like, oh, it's just another strep infection. Keep getting them over and over, right? If you don't treat that, you do run the risk of that going systemic, as in getting bacteremia throughout the entire bloodstream. If that happens, you could have your immune system catch up with it when it hits the kidneys, when it hits the glomerulus, and then you have this battle between your immune system and strep, and they leave shrapnel behind. They damage the kidneys. They cause what we call vegetations to be laying down, and that hurts the kidneys, and of course it can damage it. Yeah.
Is it possible to get strep like infection in your thyroid?
No.
Sure. Like it's a bacteria. I mean, you can get it anywhere. Yeah.
So would that happen if someone was just like, because I know someone who was just a carrier of strep, but they didn't have the symptoms. So
Okay.
like they just had, would that still happen like if it was like untreated when you still like?
It's less likely because if we're saying that they're a carrier, that means their immune system is keeping it down. Probably not going to cause those vegetations on the kidneys. It can also do it, by the way, rheumatic fever, scarlet fever, all the same thing. That means that you have strep that went systemic, and it can also affect your heart valves. They call it rheumatic heart disease because the exact same thing that happened at the glomerulus with those vegetations and scar tissue
Isn't that
can
more
also happen
common
to your
in
heart
children?
valves. What?
Isn't that more common in children than adults?
Yes, all of it is more common in children because I don't actually know why, but it is. It's more common in children. The post-strep glomerulonephritis and the heart issues. Yeah.
Is it because they're still like building immunity?
Yeah, it might be, but kids have ridiculous immunities usually. They just seem to have a weakness for post-strep issues.
Can they become systemic if they don't finish out their treatment, their
Yeah,
antibiotic treatment?
again, please beat your patients to death if you have to. If they gave you 10 days worth of antibiotics, take